Sorry, is my presentation visible?
Yes, it is visible. So we have group 5 presenting first over here. The group members are Sakshi, Vaishnavi, Siddhesh, Sahil, Palande, and Rutika. So just keeping you informed that your entire presentation as a matter of record will be recorded. Okay, over to you guys.
So first of all, good morning everyone. My name is Sakshi Naik, roll number 7521, and my group members are Vaishnavi, Siddhesh, Sahil, and Rutika. So today we are going to present on the topic urinary tract. So this poster mentions about the details of the urinary tract, the infections of the urinary tract, and how sample is collected. What are the types of urine specimen? Then how it is transport, processing, etc. So I'm going to explain you about the details of the urinary tract. So let us first start. What is the urinary tract? Okay, so now let us start. What is the urinary tract? So the urinary tract is the body's sorry, just a minute. So the urinary tract is the body's drainage system for removing urine, which is made up of waste and extra fluid. So for normal urination to occur, all the parts of the urinary tract need to work together and in a correct order. So the urinary tract basically includes two kidneys, two ureters, a bladder, and a urethra. So the upper urinary tract includes kidneys and ureters, and the lower urinary tract includes bladder and urethra. So kidneys. So these are the two bean-shaped organs, each about the size of the fist. So they are located just below the ribcage, one on each side of spine. So every day, kidney filters about 120 to 150 quarts of blood to remove waste and balance fluids. Uh, so this process produces about 1 to 2 quarts of urine per day. So the kidney removes urea from the blood through tiny filtering units called as nephrons. So each nephron consists of a ball formed of small blood capillaries called as glomerulus and a small tube called as the renal tubule. So urea together with water and other waste pass through the nephrons and down the renal tubules of the kidney. Then comes the ureter. So these are the two narrow tubes which carry urine from kidneys to the bladder. So the muscles of the so the muscles of the ureter walls continually tightens and relaxes, forcing the urine downward away from the kidney. So about every 10 to 15 seconds, small amounts of urine is emptied into the bladder from the ureter. So from the ureters. So then comes the bladder. So it is a triangle shaped hollow organ located in the lower abdomen. So it is held in place by ligaments which are attached to other organs and the pelvic bones. So the bladder walls relaxes to store urine and contracts to empty urine through the urethra. So the typical healthy adult bladder can store up to 2 cups of urine for 2 to 5 hours. So besides this, two sphincter muscles and nerves in the bladder also plays an important role. So two sphincter muscles are basically circular muscles which help keep urine from leaking by closing tightly like a rubber band around the opening of the bladder. And the nerves in the bladder basically alerts the person when it is time to urinate. So then comes a last part, that is the urethra. So this tube allows urine to pass outside the body. So firstly, the brain signals the bladder walls to tighten, which squeezes urine out of the blood. At the same time, it also signals the sphincter muscles to relax to let urine exit the urethra through the bladder. So when all the signals occur in a proper order, normal urination occurs. It is also important to know that the female urethra is relatively short as compared with male, and it also lies in close proximity to the warm, moist, and perirectal region. And is also teeming with the microorganism. So, because of the shorter urethra, bacteria can easily reach the bladder of the female host, and due to this, urinary tract infections are most prone to females than males. Then the resident microorganisms of urethra are lactobacilli, diphtheroids, propionibacterium species, corynebacterium, and the potential pathogens are primarily Enterobacteriaceae and occasional yeast. Also, it is important to know that all areas of the urinary tract above the urethra in a normal, healthy human are sterile. So now let us understand the system in brief. Like firstly, what happens? The body take nutrients from the food and converts them into energy. After the body has taken food components that it needs, the waste products are left behind in the bowel and in the blood. So then the kidneys and the urinary systems helps the body to eliminate the liquid waste called as urea, and also to keep chemicals like sodium, potassium and water in balance. So urea is basically formed when the food containing proteins like poultry, meats, and certain vegetables are broken down in the body. So urea is carried to the blood. Urea is carried in the bloodstream to the kidney, where it is removed along with water and other waste in the form of urine. So this was about the details of the urinary tract. So now let us know about the infections of the urinary tract. So I would request Rutika to continue further. Thank you.
Hello, am I audible?
Yes, Ritika, you're audible.
Yes. So now let us see what are the urinary tract infections, commonly abbreviated as UTI. So UTI occurs when a pathogen or any other organism is able to enter the urinary tract and they are able to cause infection over there. So it is basically divided into upper urinary tract and lower urinary tract. So the upper urinary tract consists of kidneys and the ureters, while the lower urinary tract consists of urinary bladder and the urethra. The lower urinary tract infections include urethritis, that is infection of urethra, and cystitis, that is the infection of the bladder. And upper urinary tract infections include ureteritis, that is the infection or inflammation of ureters, and pyelonephritis, which is the infection of kidney. Uh, LUT, that is lower urinary tract infection, shows symptoms such as dysuria, that is a burning sensation or irritation while urinating. Frequency and urgency, that is frequent or urgent need to urinate more frequently. And hematuria, that is the urine may sometimes appear bloody or it may also show cloudiness and have a bad odor. And upper urinary tract infection shows symptoms such as flank pain, that is lower abdominal pain, high fever, chills and nausea, and also include dysuria, frequency and urination. So the causative agents, as we can see, are mentioned over here. Among this, the Escherichia coli, uropathogenic Escherichia coli, is the major infection-causing agent. Now let us see the process, or basically the pathogenesis, how the infection occurs. So urinary tract infection begins when the organisms or uropathogens are able to colonate the urethra, are able to contaminate the urethra, and they are able to colonize over there. Then from the urethra, they subsequently migrate to the bladder, where due to the expressions of pili and adhesins, they are able to colonize on the urethra and undergo multiplications and also biofilm formation. The host shows inflammatory responses. Also, neutrophil infiltration takes place, but due to the virulence factors that are possessed by the bacteria or the pathogens, they overcome this they overcome the immune system, they invade the immune system, and they ascend towards the ureter. If they are not treated over here, they ascend towards the ureter. As we saw in the infections, this ureter shows inflammation. So the inflammation of ureters is due to the bacterial colonization over into the ureter, which causes burning sensation. In immunocompromised patients and patients suffering with diabetes, these organisms easily ascend towards the kidney and they colonize in the kidney. And if not treated, they may also result into acute renal failure or may also lead to permanent kidney failure. Um, then if not treated at this stage, then it would lead to a severe infection, and these bacteria may enter into the circulation via the renal vein, causing bacteremia, that is bacteria are found in the blood. And if not and this bacteremia may lead to septic shock. So sepsis basically means an inflammatory response by the host towards a severe infection, and septic shock is a sudden drop in the blood pressure which may lead to multiple organ failure. So the risk factors of UTIs are pregnancy, that is in pregnant women are more prone to infections due to their structural changes and also abnormalities and hormonal changes. Um Progesterone, which causes the stasis of urine, which enables or allows the bacteria more easily to colonize in the bladder. Sexual intercourse may introduce bacteria into the bladder or urethra. Menopause and catheterization, which is the most common way to through which the organisms or the infectious agents are introduced directly into the urethra, and it leads to most of the nosocomial infections. Also, urinary stones or kidney stones, which blocks the urine flow, due to which also the bacteria may colonize and cause urinary tract infections. Now, let us hear from Siddesh about the sample collection and how it is processed and what are the precautions that needs to be taken. Okay, let me switch off the mic.
Ritika, thank you. Thank you, Ritika, and I am Siddesh Navlu, and I will be discussing this how the specimen about the specimen techniques used for collection of urine sample. So the first technique is clean catch midstream urine collection. So coming to that, clean catch midstream urine. So what does it mean by midstream? Uh, by midstream urine. So midstream urine sample is means that you do not collect the first or the last part of the urine that comes out. So coming to the procedure for of these techniques for female patients. So the steps are like the first, the vulva and labia should be cleansed thoroughly using a sterile cotton gauze pad and warm soapy water. After that, the vulva and labia should be thoroughly rinsed with water with water and then dried with a sterile gauze pad. Then the first few milliliters of urine should be passed into a bedpan or toilet bowl to remove the bacteria from the urethra. Then most of the remaining urine should be collected in a sterile container. And as soon as the urine has been collected, the lid it should be closed with a lid as soon as possible. This is how the midstream urine collection takes place. Then as the sample has been collected in the container should be sent labeled and sent to the laboratory for further examination. When it comes to procedure for males, the patient should wash his hands thoroughly with soap and water and then dry them with a clean towel. Then the patient should pull back his foreskin and wash the glans penis thoroughly with sterile gauze pad and warm soapy water. After that, rinse the glans penis with sterile warm water and dry it with sterile gauze pad. Then during the entire procedure, the patient should not touch the cleansed area with his fingers. Then pull back the foreskin and pass a small amount of urine. Still rolling back, the patient should pass most of the remaining urine into a sterile container again and closing the lid as soon as possible. The sample has been collected. Then after the collection of sample, it should be again labeled and sent to the laboratory for further analysis. Then the advantage of this technique is that it's the least invasive technique considering the other techniques. Now let's have a look at what precautions should be taken while performing this technique. So the first major precaution is that the patient education. The patient should be educated very well. Like we can do this by providing a guidelines, by providing guidelines for proper specimen collection should be prepared and printed on a card, maybe in bilingual languages or whatever the language the patient can understand, or maybe and the procedure should be properly described. The patient should be clearly instructed to clean the pre-urethral area so that with a mild detergent should know to avoid contamination. Then uh, then the last precaution should be that use of disinfectant should be avoided. Since the genital area is quite sensitive, it's not recommended. Then the second technique is catheterization. So catheter is a flexible tube made up of latex or silica. It is inserted into the bladder via the urethra. The urine is then drained from the bladder to the collection, and the catheter has three openings. The bladder opening, three openings. It has a bladder opening, the end which goes inside the urinary bladder. Then it has the drainage port from which the urine comes out, and it has a third port which is called as the balloon port, from which we insert a fluid which goes into a balloon like part, or exactly balloon, which is just before the urethral opening. So when we inject the fluid in this when we inject the fluid in this balloon, the balloon will obviously inflate, and then it will inflate, and it will that tube will get stuck into the urethra, so that when the process of urination starts, the tube won't pop out. Then coming to the procedure, the catheter tube should be gently inserted into the urethral opening. Then as you feel that it has reached completely inside the bladder, then we can inflate the balloon with water. Then wait till the urine flow starts, and then we can collect the urine sample. The the precautions during these techniques are that catheter should be inserted very gently and by holding the pilions firmly so that it passes through the urethra easily. And while inserting the catheter, the catheter should be held at the intervals of 2 to 3 centimeters, so that when you apply the force to insert it, it won't bend and cause any harm to the urethra. Um, and urinary catheterization provides a method for collection of uncontaminated urine directly from the bladder. So it's much preferred technique, but it also has some risk factor, like if the catheter is contaminated, then it might introduce nosocomial diseases. Then the last technique is suprapubic aspirations. So suprapubic aspirations are reserved most extensively for neonates and small children. The procedure is best performed when the bladder is full. The suprapubic skin overlying the urinary bladder is disinfected, and the sterile drapes are put in place. Then in the site where the aspiration is to be made, an anesthetic solution such as 1% indole calin HCl is injected subcutaneously. Then after a while, then an 18 gauge short level spinal needle is injected into the urinary bladder, and 10 ml of urine is aspirated into a syringe, and then transferred into a container. Then the container, as usual, it should be sealed properly and labeled and sent to sent to for analysis. Then next are the types of urine sample, which will be explained by Vaishnavi. So over to you, Vaishnavi.
Okay, thank you, Siddesh. So, looking at the types of urine specimens, so over a course of period, like a 24-hour period, the composition and concentration of urine changes continuously. So, for this reason, various types of specimens can be collected. First being the first morning specimen. This is particularly valuable because it is more concentrated and abnormalities are easier to detect. The second is the single random specimen. These can be taken at any time of the day or night. Then the third one is the timed specimens. Timed specimens range from short term 2 hours to long term 12 or 24 hours collections. Then there's a catheterized specimen or specimen from an indwelling catheter. Catheterized specimens are taken when the patient is bedridden or cannot urinate properly. Then there's a suprapubic aspiration specimen. This method is used when a bedridden patient cannot be catheterized or a sterile specimen is required. Then there's a pediatric specimen. These are specially for small children or infants. Like a special urine collection bag is adhered to the area surrounding the urethral area, like the skin surrounding the urethral area, and the urine is collected in that bag. And then comes the most common specimen, that is the clean catch or midstream specimen. It is used for culture and sensitivity testing because of its reduced incidence of cellular and microbial contamination. Now we'll look at how the transport, time, and processing of a urine specimen takes place. So, in order to ensure proper stability of the sample, these guidelines should be followed. First is that ensure the transport container lid is secure and leak resistant. This is for a simple reason, that is to reduce specimen loss. Then utilize urine containers that are made of break resistant plastic instead of glass. This is also for a basic reason that break resistant plastic would be more safer than glass to handle urine. Then verify that the sample is properly labeled using at least two forms of positive patient identification. For example, the patient's name, date of birth, or the hospital medical record number. Then verify that the time the specimen is collected is documented. Urinalysis samples, or rather any urine sample, needs to be examined within 2 hours of collection. Transport urine specimens to the microbiology laboratories or refrigerate within 30 minutes at 2 to 8 degrees Celsius and specifically at 4 degrees Celsius. Also, urine may be transported at room temperature in a tube with preservatives and can be processed within 24 hours, only if the preservative is added. The most common preservative used for culture and sensitivity is boric acid, but also hydrochloric acid, oxalic acid, or acetic acids are used as preservatives. Now, I would like Sahil to continue.
Thank you, Vaishnavi. Good morning, everyone. My name is Sai Palande, roll number 7524, and I would be speaking today on the topic of gross examination of urine samples. So, the definition of gross examination is like the initial visual examination of the urine sample, and this is mainly divided into the following types, such as color of urine, odor of urine, appearance of urine, foaming, and the pH. So basically, starting with the color of urine, the normal color of urine is pale yellow or straw-like color, which is due to the urochromes present in the urine, and in some abnormal circumstances, it can also range from like brown, dark brown, black, or up to red colors. In about blue and green in middle also. So in this case, we should also note that food consumption or like drug consumption by the patient also can cause the change in color of the urine. For example, red color urine could be due to RBCs present in the blood, or also could be the heavy consumption of beetroot. uh, for another example would be white color due to WBCs present in the urine, and also the main example in this color of urine would be a bluish green color that would cause due to some pseudomonal infections, or maybe due to consumption of drugs such as amphotericin, which is used as antidepressants by the patient. So therefore, it becomes a crucial factor to know about the food consumption or the drug consumption of the patient at least 24 or 36 hours before. Secondly, we'll see the urine odor of the urine. So freshly voided urine has a slightly fairly aromatic or urinoid smell due to the presence of volatile acids. In case of UTIs, strong pungent smell is seen. Also, standing urine for a long time can also have ammoniacal smell due to the activity of urease, which which it converts urea into carbon dioxide and ammonia. Also also the odor of urine could be like fruity smell in case of diabetes, or like maple syrup like smell in maple syrup disease. Thirdly, appearance of the urine. A freshly voided urine is clear and translucent in appearance. It can appear turbid in presence of WBCs or skin contamination of vaginal secretion, particularly in case of females, if the contamination is introduced while specimen collection. Also, long-standing urine can have turbid appearance due to the solute precipitation, and also yeast infections can make the urine look cloudy in color. or appearance. Fourthly, there is foaming of urine. In normal urine, no foam is routinely seen, but in case of strong agitation or shaking, the foam may appear and it may dissipate easily. In case it can shed light on abnormalities present in the urine, or also can point out towards the disorders present in the patient. For example, if the amount of bilirubin which is present in the humans is present in high amounts, a characteristic yellow foam is seen when the urine is agitated for a long time. The picture of the test tube which is shown here is the patient with high amount of bilirubin present. So this is the characteristic yellow foam. Lastly, there is the pH which we can measure using the litmus paper. So the normal pH range of the urine is slightly acidic to neutral range. So this pH can shift towards the both sides because of different causes. Acidic urine is seen in case of patients with diabetes mellitus because of the acidosis in them, and also alkaline urine is seen in patients with urinary tract infections, which can be analyzed by the urease activity, and which turns the urine into alkaline condition due to presence of ammonia in it. So lastly, we'll move towards the conclusion part. So the main motive of this was to spread knowledge about the UTIs present, and we as group would like to give some tips to prevent UTIs in patients. So the main tip would be drink plenty of water. So it would help the patient to dilute urine and flush out bacteria very easily. Also, it would reduce the causes of kidney stones or other solute accumulation in the urine. We would also like to give advice to avoid drinks that may irritate your bladder, and also use a heating pad to minimize bladder pressure or discomfort. Also, we would like to tell if you suspect any urinary tract infections, please consult a physician as soon as possible and to cure the UTIs very easily. So thank you. These are our references. Thank you, sir.
Okay, good job. I can see that a lot of details about the collection analysis part have been covered, which is a very good indication that you have done good reading. So that's a pretty good job. Also, please start posting questions in the chat box while we start asking questions. So, can you go back, Rutika, to the anatomy part of the UTI? Can you show me that section? Right. Okay. So, when you talk about the anatomical features of UTI, whoever dealt with this part, if I'm not wrong, Sakshi started, right? So, can
Yes,
you
sir.
tell me that which of the parts of your urinary tract can get infected?
Mostly the lower urinary tract parts like bladder and urethra, but sometimes severe infections can also affect kidneys as well.
Okay. Okay. And any idea of what are the organisms which normally affect the urinary tract? Did you come across any set of organisms which cause infection of the urinary tract?
Uh, like so, like Rutika also mentioned about it. I think
Yeah,
the
Rutika can also answer it. Rutika, if you can take over the question, because I think you discussed about the
Yes,
infections
sir.
associated. Yeah.
Yes, am I audible?
Yes, you are.
Okay. Okay, so most commonly we can see uropathogens, including E. coli, and these E. coli have like they have developed virulence factors over the time, which includes like hemolysins and also fimbriae, and we can also see Proteus mirabilis, and also Candida sometimes, which causes fungal infections, and
Mm-hmm.
also Staphylococcus aureus. And there are many other, but the most common organism is E. coli.
Okay. Can you show me the section of sample collection, please? Okay. So, Siddesh, when would you go for suprapubic aspirations other than neonates and small children? Is there any other situation where you will have to go for suprapubic aspirations?
Um, uh, if the patient can't control its urine, like it's lost its splinters function somehow, like it's completely bedridden and all, in that case suprapubics are preferred.
Okay. And when you talk about midstream urine, you said that midstream urine collection is what is more preferable, right? So, in
Yes,
those
sir.
circumstances, is it the same thing for both males and female patients?
In every are you asking as a comparison between male and female in any circumstances, or
In
like
any circumstances?
yes, sir. Midstream unit is highly preferred in both male and female patients. Because whenever the few millimeters are like discarded, the remaining that we assume that it contains the pathogens or microbes which are present in the urethra. So whatever, and then which is the midstream part, we can surely assume that it's coming from bladder, and if it has organisms, those organisms are from bladder.
Okay. Can you go below to the next part, Rutika? Yes. So here, Vaishnavi,
Yes, sir.
I wanted to ask that which are the conditions for which you collect these long-term specimens of urine?
So, as in like the time conditions.
No, no. I mean, in which specific conditions? I mean, कौन से health conditions के लिए ये
Okay,
preferable
okay.
होता है?
Yes, sir. So time specimens are generally used to detect like the amount of urinary components in the urine.
Okay.
So, and like the 24-hour specimen is extremely important, like in diagnostic tests. It reveals like how the kidney adjusts to changing physiological needs, like over a long period of time.
Mhm. And why are morning specimens preferable, or when are they preferable? In which conditions?
So morning specimens are preferable because firstly they are more concentrated, so they contain like high levels of cellular element and analytes like such as proteins if present, but they have a high level of cellular elements and the concentrations that makes it easier for the test results. Like we get more accurate results.
Okay. Okay. Rutika, can you show me the gross examination part, please? Okay. So here, Sahil,
Yes, sir.
can you repeat about foaming part of urine? When do you see foaming in urine?
Yes, sir. So the normal urine on a freshly voided normal urine does not have foam, or if the foam may appear if the urine sample is agitated or shaken vigorously. Secondly, in case of high concentrations of bilirubin present in the patient, the foaming could appear like the characteristic yellow which is shown in the figure. Otherwise, no, foaming of the urine does not shed light on any indication upon the urinary tract infections. It can only shed light upon the abnormalities present in the patient, like disorders.
Okay, okay. There are some questions in the chat box. You can start taking it up.
So can I answer Saloni's question?
Please go ahead. You don't need to ask. You can start
Okay.
answering the questions.
Okay. So Saloni, basically, diabetes is the condition in which the blood sugar level increases, right? So this basically weakens the person's immune system defenses. So basically, the person who had diabetes for a long time, in those person mainly the blood flow is reduced, and so this increases the chances for infection. So the diabetes patients are at a higher risk of urinary infections.
To answer Maitreya's question, so boric acid it converts urine into an effective like a bacteriostatic medium. So it is an agent that prevents the growth of bacteria. So this eliminates the chances of false positive results because there will be no extra bacterial growth. And one research also says that it also boric acid also preserves WBCs in urine, and so it is improved for the diagnosis of pyuria. Pyuria is like a disease like in which there's pus in urine. So it is basically white blood cells in the urine. So boric acid helps for that also. So that is why it is more preferred.
Answering about the Maitreya's second question about maple syrup urine disease. So it is a disease in which it is a rare inherited metabolic disorder where the body cannot break down certain amino acids, in which there are amino acids like leucine, isoleucine, and valine, which are also called as branch chain amino acids. So in this case, the patients are told to stay away from foods such as meat, eggs, and milk. Also, it could also rise levels of keto acids in the body.
Yes, sir. Regarding any bacteria which prevents us against UTI pathogens, so there are lactobacilli which reside in the urethra, and they usually maintains acidic conditions because of which most of the pathogens are killed over there, and thus they prevent. And also the urine itself is like prevents us from various pathogens which colonizes, and along with it it flows the pathogens also. And also the pH of the urine, it prevents us or it prevents the bacteria from multiplying over there.
Speaking about the volatile acids in the urine, a paper in a paper in NCBI mentions there are like carbamic acid, monoammonium salt, 2-pentanone, 2,4-dimethyl pentanal. These are some of the urine, which are some of the urine acids, volatile acids present in the urine. So you can always refer to the volatile acid papers in the NCBI for the for the volatile answer.
Okay, I think if that is it, thank you so much, Group 5. You can stop sharing the screen now.